Hey, this is a major triumph.
I'm starting to think that it's you guys, Kevin and Lena.
Really? That's what.
Yeah.
You don't let me in a lot of places, Jenny. This is.
Well, whoever was able to launch, thank you, because I just don't have the capability to do so.
Elaine may be on, but I cannot hear her. So if there's anything to be done about that.
I see her.
I see her too, yes. So that's good. But if not, then we'll move on. I guess I'll let the panelists maybe introduce themselves because we cannot hear Elaine. So I'm sorry about that. Should we start with Lena? Do you want to just, I see we have a nice gathering and we were a little delayed, so we may as well jump into it. I'll let Lena go first.
Sure. Hi, everybody. I'm Lena Andrews. I'm the Director of Real Estate Development at Action Housing, and I'm excited to be here. And I wasn't planning on introducing myself, but I'll talk a little bit more about Action once we get to my slides. And thank you for allowing my co-presenter, Kevin, even though he's a man. That's a joke. I know there are men in this group. But Kevin, do you want to introduce yourself?
Yeah, no, grateful to share a little bit about what we've been working on. So my name is Kevin Progar. I work with the UPMC Center for Social Impact. And so that is within the health plan side of UPMC, not the hospital side. So one of the things I'm going to touch on is, kind of how that makes a difference and kind of, how there's different motivations about, kind of addressing this work. So I've been fortunate enough to, start working for us to deepen our commitments and ways that we invest in housing or programs that serve as supports for people who need housing as well. And, happy to talk more about that in a little bit. So, Lena, I don't know, is it me first or you first or?
And let me text you.
I don't remember, but maybe you go first than me. That'll make more sense, I think.
All right. I'm going to try to steal the screen if that works. Hopefully it does. You seeing slides?
Yes, definitely.
Okay, great. So yeah, UPMC Center for Social Impact. I just kind of did the quick caveat that, so again, starting with the Insurance Services Division. I should add that, that counts all of UPMC's various insurance programs. So that is all of the business units that support all of our lines of business. So that's commercial insurance, managed behavioral health, managed Medicaid, managed Medicare, combinations of those things, long-term community service and support. So UPMC Insurance Services Division is one of the most diverse kind of payers in the state of Pennsylvania as far as who we serve. And a lot of our business happens to be people with low incomes. And so that's kind of the backbone of, where UPMC Center for Social Impact is. It's kind of hard sometimes to define exactly what it is we do. It's more kind of, we don't necessarily do any of the things you're going to see in these circles, but we're really trying to be a way in which we're making sure that everybody who's working in a specific domain around our members' needs are working in coordination with each other, best leveraging assets from the diverse set of resources that we have, having so many different product offerings to different populations, and so really it's about kind of establishing strategies. So I'm going to talk about Homeward, which is one that I've helped, kind of leadership kind of form our ideas about how we take on housing across the board, documenting and reporting what works, coordinating programs, so that's really working with our evaluators to get an understanding of what's the presence and impact these things are having. And then really, developing pilots, some of which we'll talk about today, and, figuring out what works to the best of our abilities. And I want to spend a couple of minutes just kind of setting the scope of kind of terms and things like that. So we heard a lot about, I think people are now hearing a lot about social determinants of health. Housing is a core component of that. But this is really, the illustration on the slide in particular is really about trying to highlight that. So social determinants are the reality of, where folks are. And that gets at the underlying fact that health outcomes basically 80% of it happens, 80% of your health outcomes are attributable to what happens between your doctor visits, regardless of where those doctor visits happen, if it's a hospital, primary care, whatever it is. It's those other things. Social risk factors are the predictors of you being in an environment where you're going to experience challenges, whether that's with food access, transportation, housing, whatever it might be. And health-related social needs is really the I need a ride versus we need more bus service in my neighborhood. And so that's kind of one of the things we want to try to touch on is we talk, some of the programs we do really are person-centered and driven around our membership in particular. And those are to address the health-related social needs. But obviously our members and the rest of the community we serve doesn't all kind of carry the same insurance cards. So we know that there's things we need to do that are community-driven and trying to add value across the board. And then this gets back to kind of the motivations around health in particular. So population health is really what we do as a health plan. What service and offerings can we provide that let our members kind of have their fullest and happiest lives, healthiest lives? That's a lot of where we've seen leadership from State Department of Human Services recently is saying, hey, everybody who has these managed care or Medicaid contracts, what does it look like for you to get innovative and forming community partnerships around these things that serve members? So it's really about treating those health-related social needs to a certain extent. And then community health is really, one of the factors we also think about, which is, kind of neighborhood development. That's where CDCs really come in as stewards of, what does it look like for us to offer workforce programming as well as, a housing strategy, as well as childcare options. And that's really when we start thinking about community health and trying to think about, where can we focus our efforts where the people we serve live? And public health are some of those bigger question things around lead and water and the really clear cut stuff, but it's really hard. It's not as intuitive for us as a payer to necessarily take it on because it affects everybody. So there's just different motivations. We have lots of conversations with people who work across the spectrum and try to figure out ways to contribute where it makes sense. And so mostly the question is, why housing as, part of this or part of the strategy we've taken on. We really have the most developed portfolios around things like community health workers, workforce supports, and housing. And it really is just as simple as these three words, rent eats first. And so this comes from the fine people at the Joint Center for Housing Studies at Harvard. You can see whether it's children or seniors, when people are cost burdened, they're paying less for food and paying less for healthcare, which typically means they're deferring care. And what we've seen through our own programs, some of which I'll touch on, and other national research, so this comes from some work that Enterprises and Center for Outcomes Research did a couple of years ago, is when we build the housing stability, we see kind of the appropriate care goes up. But really, that's our goal. It's not to limit people's care, it's to make sure they're getting the right services at the right time in the right place. And that's really this number 2 box here is, primary care goes up. That's a great thing. Medication adherence goes up. That's a great thing. We spend money on that, but ER visits go down. And it's those kind of flexibilities that really allow us to do this work. And so Homeward is our effort to kind of create healthy housing options. And it works. We're trying to work across this whole continuum of housing needs. So really thinking about homelessness, emergency transitional housing, and programs that really support capacity there. Lena and her team have been actively involved in a couple of really neat things on that front. Combating cost burden or rent burden, really thinking about what does it look like to expand the supply of affordable housing, because we can't, folks need that option as well. And one of the things we're hoping to do more of in the future is really thinking about ways that we can contribute to home ownership opportunities. And so the landmark program for us is Cultivating Health for Success. This is a permanent supportive housing model that's evolved over the last 12 years. It's served 141 people. And in 2019, we were able to kind of move this into a way that used a different form of housing subsidy. So the program at its core is a permanent supportive housing model that has a subsidy provided from usually a public source of some kind. CBO partner of ours who does navigation helps with application support and long-term living support, making sure people are comfortable in their daily lives, accessing benefits, applying for disability, whatever that might be, and then a care manager who really focuses on the healthcare motivations for that. And so it started out for the first 8 years as a shelter plus care model, so like very rigid, very defined, about 25 slots. And we reimagined this in 2019 for what would it look like to allow our community partners to use their knowledge to find the best fit for the best program. And so one of the things that's most exciting about looking at this membership over time is two things. We see that 29 of the 141 people that have been housed have moved on to full self-sufficiency at the end of the program, and they're keeping a housing choice voucher, things like that. So we are able to serve more people because we're now using underutilized assets, primarily Section 8 vouchers, sometimes LIHTC units, to house people who would otherwise not get housing through the continuum of care, the HUD funding. And so that's really been the innovation here, is allowing the blending of those housing dollars. And we see a full-on improvement in people's lives, healthcare expenditures, same thing as before, where it's really that kind of appropriate care goes up. And people generally stay in the program for quite a while, or as long as they need. So able to offer this in new counties as well. So that's offer this currently in Allegheny County, Lawrence County, and Blair County. So hoping to see this grow even further. I'm just going to kind of keep rolling and kind of pause for questions at the end. Does that sound good to everybody? Okay. And then so that program kind of led to why can't we just serve more people? And it's there's not a lot of units that are even Section 8 ready, or, it's really about having places for these members who could qualify for a program like a permanent supportive housing to go. So we were one of 6 health systems that participated in this initiative called Accelerating Investments for Healthy Communities. Lena and others from Action were, pretty involved with helping us think through this. And have been the recipients of some of the early funding that we've done. So it's really just around how do hospitals step in and think about where they can use other assets beyond just grant funding and closing gaps in individual products, and really thinking of projects and thinking about, what can we do to make sure that there's more affordable homes and affordable rental properties being developed each year. And so to date, we've kind of supported. We've closed one loan to Bridgeway Capital. It's created an $8 million lending pool essentially. And these are kind of what we see. We will talk about a couple, I think 2 projects that were funded through this process. But in addition to that, one of the things that was interesting to us is the URA launched the Small Landlord Fund in cooperation with PNC Bank, which is really geared at repositioning units for low-income households and accepting vouchers. So that's another place where some of this can be interesting. And there's kind of that direct connection where that voucher absorption increases, so does our ability to place members who need things like permanent supportive housing. And so those are kind of the 2 ends of the scale. So accelerating investments in this work is really, that's the social determinants. How do we get more dollars into the hands of developers to be able to solve, kind of get more creative with their financing. And then on the social needs side is really programs like Cultivating Health for Success. And so you'll see I tag some of these different things, health-related social needs, population health, just kind of for reference. And I'll let Lena, I think this is in Lena's presentation, so I'll let her take on the bulk of this, but Highmark and UPMC have both pledged investment capital and kind of operating a clinic at Second Avenue Commons, which is going to be basically a no barrier shelter. Great community asset, great project, kind of pulled together with a ton of contributors, and just we're really excited to see where this goes. So SRO beds as well, or some emergency beds as well as SRO units, which is really exciting to us because it's that transitional time that's really essential. Another action project, I'm highlighting that just because Lena's here and able to speak more in depth about it, but things like SRO units are there. And one of the ways that we participate through this program, again, gets back to the way that we're working across the Insurance Services Division. So this is actually funding provided through the Department of Community Economic Development's Neighborhood Assistance Program. And so it's some of the for-profit insurance offerings that are then able to kind of extend those credits in the matching philanthropic support to bridge into projects like this one. In no cases are we really carrying the majority of financing or anything like that. But we are trying to get creative with the assets we're using. So working with our hospital partners, there's a land agreement for a site at Forbes and Craft in Oakland for an LGBTQ senior community that's kind of in process. This is anticipated to be submitted to PHFA sometime this year. Again, this is kind of social determinants, really thinking about community health, really thinking about specialty populations. So senior members identifying with the community have a lot of struggles in being able to find homes they feel comfortable with. And then another example where we're working with our managed long-term service and supports, which provides community-based assistance to help people with disabilities or who are aging kind of stay in place. Is a home repair program that we were working with on Rebuilding Together Pittsburgh. And basically that will address things that we can't cover under the current benefit, which will do home mods, things like that, install ramps or chairlifts, but you can't put a ramp on a porch that's not structurally sound, and you can't put a chairlift into a house that has a electric panel from 1935. And so we're piloting this concept with Rebuilding Together Pittsburgh to say, what does it look like to address those needs for our members in order for them to kind of maximize all those other things. And we think that you will have meaningful investments in the communities, as well as kind of protecting the wealth of those individual homeowners themselves. And this slide just kind of recaps kind of all that stuff on a continuum of the different pieces we're using, and kind of how we're starting to build towards our goal of reaching $40 million and hopefully beyond. And as far as how we support these programs, some is value-based contracting. Those are things like the pilots that kind of help address the health-related social needs. Others are in-kind donations of services, grants, DCD tax credits, and the like. So that's basically it for me. So I'll just pause there or kick over to Lena. So I guess, yeah.
Let me ask, can people hear me now? Yay, okay. I'm so sorry for all of that craziness, and thank you to Penny for jumping in to intro at the beginning. But yes, I think we were gonna have, Kevin, you go ahead and your materials. So Lena, if you are ready, want to go through yours, and then folks, please feel free to put questions in the chat if you have one that you want to sort of parking lot, and otherwise we'll just open to questions when Lena is done.
Great. Okay, let's see. I successfully got out of the waiting room. So now let's see if I can get my slides. Can you guys see them?
Yes, ma'am.
Good. And I changed the date, so that's good. Hold on. Let me. Where's the? Oh, there we go. Okay, great. Thanks so much for having me, everybody. And Kevin did a great job covering the history of how Action Housing and UPMC have been working together to connect affordable housing and healthcare in the Pittsburgh region. I'm Lena Andrews. I'm the Director of Real Estate Development for Action Housing, and I'm going to start with some background on my organization and then talk about some of the different ways that we've been working with UPMC, which I will cover some of the same things that Kevin did, but probably talk about it in a different way since I'm an affordable housing developer. And I was thinking about like one way to describe it, and people always ask me like, oh, how do you solve the affordable housing crisis? I'm like, well, you need to use every single tool in the toolbox. Like it's not just inclusionary zoning or just more money or just advocacy or all these things. You need everything. And I feel like Kevin and I have been working together in so many different ways. So we're trying to use every different tool that we can come up with to collaborate. So hold on one second. I just have to move this toolbar here because I can't see my own slides. Okay, so Action Housing, I think a lot of you are familiar with Action Housing, but we are a nonprofit affordable housing agency located in downtown Pittsburgh. We've been around since 1957. Sometimes I feel like I've been there the entire time, but I've actually been there 9 years. And we have developed about 4,500 units of affordable housing in the Pittsburgh region since 1985. A lot of it is supportive housing. We currently own about 1,400 units of affordable housing in the Pittsburgh region. We manage some of it ourselves, some of it we contract out. We also provide a lot of services that help make housing more affordable and help people stay in their homes, such as rental assistance, foreclosure prevention counseling. We operate one of the largest weatherization practices in the state, and we do some service provision, such as we have a program for youth who've aged out of foster care, but we often partner with other nonprofits to provide supportive services in our building. We do many, many, many different things. As I mentioned, we specialize in supportive housing for vulnerable populations. So we are very, very focused on healthcare and improving health of our residents, and we do this in partnership with many different nonprofit service providers around Pittsburgh. We are the main developer right now engaged in maintaining the network of SRO housing, single room occupancy housing in Pittsburgh. We just finished the renovation of the Center Avenue Y, which Kevin talked about. We own the Keysport Downtown Housing. We are the main, we're the driving force behind Wood Street Commons downtown. So all of those units together are more than 500 units of SRO housing, which really are serving as a safety net against homelessness in our region. And a lot of our residents in these buildings have pretty extreme healthcare needs. So, I mean, it makes sense to me just intuitively that when people have housing, obviously their health is going to improve. But this is a diagram I found on the internet that to me helps define like the different ways that housing can impact health. The stability, just sort of having a place to live is really good for mental health, and the stability elements, quality and safety. So the actual quality of materials that we're using, having good air quality and using low VOC paint and having natural light, sort of the quality, no lead, the quality of the environment that you're living in has a major impact on health, especially for kids. Affordability is so important because as in the diagram that Kevin showed, rent is often the highest expense that households have. So if your housing is more affordable, then you can afford healthy food and you can afford transit and you can afford all the other things you need to have a good quality of life. And the last one is neighborhood, so location of housing. And there is a lot of research that shows that where you live has a huge impact on economic mobility in life, especially for kids. And that has a lot to do with access to schools and access to employment opportunities for parents, but the location of housing itself is also really important. So there are many different ways we're partnering with UPMC. We know that housing improves health, and UPMC knows that in order housing improves health. So it makes so much sense for us to work together. This is a development project that UPMC has supported financially. This is Flats on Forward, which is located at the intersection of Murray and Forward in Squirrel Hill, right at the entrance to one of Pittsburgh's strongest real estate markets. Everyone will always know this project and the one next door as the projects where Poli's used to be, because we're all Pittsburghers. But we've been working in this area for a long, long time. And this project was extremely challenging to get off the ground. It has a lot of site issues. I think I saw Dina here earlier, so she's very familiar with them. And I think I saw Cindy too, who worked on this site before. So a lot of you know how hard this site was to develop. And one of the hardest pieces for us was finding funding to make the commercial part of the project work. And so we were able to access those funds. UPMC has created a loan fund through Bridgeway that is helping to finance the commercial condo first floor of this, which made the whole thing possible. We're going to have 43 units of affordable housing, and a quarter of them have a preference for people with disabilities. We have a huge, huge waiting list for the building next door, which has 33 units. It's hundreds of people, and we closed it. So I'm sure there's going to be a lot of demand to live in this building. And UPMC was a great funding partner. So as I said that already, oh yeah, and it will be done in 2023, or else I will lose my mind. So it better be done in 2023. That's all I can say. And we've come a long way since this slide. I need to update the image. I don't know if you've been over there, but it's coming out of the ground. So Kevin talked about Second Avenue Commons. This is another really innovative project. It's Pittsburgh's first new low barrier homeless shelter downtown, and it is really innovative. It has a healthcare clinic in the building that's going to be operated by UPMC. It has a space for dogs for people who want to go there with their pets. It has SRO units upstairs. It has multiple service providers. We're going to have food provision from Community Kitchen of Pittsburgh, and it has substantial investment from the corporate community in Pittsburgh. Really, PNC, UPMC, and Highmark made very, very large, basically philanthropic contributions, which paid for most of the development costs of the project. There are a few foundation grants as well, but most of it came from corporate Pittsburgh, which is unusual and caused it to move, which seems to me at the speed of light, but it's very, very needed to address homelessness. So we were very happy to partner with UPMC, PNC, and Highmark on that one. And I need to update my photos, guys. These are from March. So sorry, there's a building here now. If you've been on the kind of Boulevard of the Allies going up towards Liberty Bridge, you'll see it. It's, you know, almost totally enclosed. So I need to update this, but it's right next to the renewal building and in the location where the Mulder pool used to be. If you ever worked for the city and had to borrow a car, that's where they were parked. So another interesting initiative is the Preservation Working Group, which Kevin has really helped to spearhead along with Neighborhood Allies, Action Housing, URA, County, a lot of other. Elaine has recently joined our ranks. So this is a group of stakeholders that are trying to make it easier to do preservation work in Pittsburgh and encourage preservation. So that includes advocacy for new funding sources, trying to build development capacity, looking at the different barriers to doing these types of deals in Pittsburgh, because there are a lot of expiring use LIHTC projects coming up as the market has gotten stronger in Pittsburgh. More and more sort of naturally occurring affordable housing has been snatched up by investors, some from outside of our region, which as someone who grew up here, that's totally a new concept for me. And, you know, we need, from that study, 17,000 new units of affordable housing. But if we're losing that affordable housing that already exists, then we're, you know, need a lot more than that. So this group has been trying to come up with different strategies for preservation, and UPMC and Kevin have been a very active part of it. I feel like we're making progress. This is another project that we're working on that we access that UPMC fund. This is Stanton Highland Apartments. This is the apartments that used to serve the Pittsburgh Theological Seminary, actually like 2 blocks from where I am presenting to you right now, because I live very close. In Highland Park, really great location, really nice brick buildings. The seminary, fewer and fewer of their students were living on campus, so they put these apartment buildings out for RFP. And Action Housing was selected to purchase them and make pretty modest renovations to them and keep them as long-term affordable housing. So this is really a preservation project in a great location. And we've been, some of the youth from our My Place program, which is the program for youth who've aged out of foster care, are living here. And it's a really good preservation project. And our cost per unit is way lower than on our LIHTC or some of our other renovations. And UPMC provided a grant and a loan to this project. I can't remember the total amount, but they funded it in 2 different ways. So it's going to be 54 units by the time we're done. It's happening in 2 different phases. This is phase 1, which was completed in 2020. And phase 2 is construction did not begin. I feel like I'm talking to developers, so you guys understand why these timelines slip. But the construction will begin very soon, but it hasn't quite yet. The housing authority is involved. I don't know if that explains anything. And so we, as you know, Action Housing operated the ERAP program, the Emergency Rental Assistance Program. This was the federal funding that came through as a part of trying to stop evictions from happening to people who lost income because of COVID. So there was lots and lots of federal money that went to states very quickly and had to get out the door. And so we went as a staff, we had 100 staff people to 140 so that we could operate ERAP. It was very, very fast, but we had to throw it together really quickly, and our staff did a great job. I think Allegheny County had some of the highest performance in actually getting the money into the hands of tenants and stopping evictions. And UPMC helped us by funding a staff position who helped process applications, I think for UPMC Medicaid members. I don't know all of the specific details, but this helped people on Medicaid not get evicted from their apartments. So it helped boost our capacity. And they also committed funds to the Housing Stabilization Center, which is a physical location on 7th Avenue downtown where people can go to get help with their applications and meet with people in person so they don't have to deal with the internet. And it's also next to Subway, so it really smells like bread, but it is important that it exists. That smell just, it gets to me. Oh, that's it. Okay, so and the one that I didn't, Kevin covered it, but Center Avenue Y, UPMC invested through that through the Neighborhood Assistance Program, and so that was also kind of innovative for us. We hadn't used NAP in that way before for real estate, so that was new. So we're basically just like throwing everything at the wall and seeing what works, and I think we're making a lot of progress. We're on a journey, and that's all I have. So with that, I'm going to get rid of this PowerPoint, stop share so I can see you. Yeah, and so are there any questions?
Yeah, and actually,
Yeah, so I see there's, oh, go ahead, please.
oh, no, just picking on one thing. So like with the stabilization center, so that's just going to be for the general operating support. And then with we added a staff person that allowed Action to backfill. So it's not like we were like stealing somebody. We were adding a full another FTE
Oh, yeah.
and process general population applications. We were just making sure that, there was additional capacity, and, per the state regulations, we have to fund things that help our members. So that's just to clarify that one. And then the other thing we used through the neighborhood assistance program, the neighborhood partnership program, which are multi-year commitments. We have a number of those with different organizations. So last year we made 6-year commitments to the Hill CDC, Operation Better Block, longstanding one with Hazelwood Initiative, and others too. So just want to kind of highlight that as well as one of the ways that we're kind of approaching the community health that has some of a real estate aspect, but also really this kind of capacity function of it as well. So just wanted to kind of extend that because I realized I didn't touch on it, and just think that that's, picking up on Leah's theme of everything we can do out of every tool out of the toolbox, we're trying to use it.
Yeah, and I forgot to
Wonderful.
mention with the preservation work, but the goal of that is to start to create a fund that can be used for preservation deals. So that's a major piece of work that I think will move forward in the not too distant future.
I'll flag, so there was one, indeed, fingers crossed. So there's one question kind of in the chat around the involvement in the housing authority, specifically in the preservation group, but I would actually, sort of expand the question a little. Have you found that the housing authority, either of the city or the county, as the sort of administrators of Section 8, have they had involvement in this? Are they sort of a necessary partner when doing projects like this? Have they been, peripheral? I'm just really curious where they've been involved and where they haven't.
We work with the housing authority in many, many different ways. I wouldn't say that the triangle of like the health element and the housing authority and Action Housing has really come together. We do have project-based contracts for a lot of our supportive housing units. So we've definitely used project-based vouchers to subsidize rent for people with different types of disabilities in many of our LIHTC projects. And in the preservation space, the County Housing Authority actually just bought one of our buildings. So they're taking on more in their real estate portfolio, which, gives us capital to do new projects and maintains the property as affordable for the long term. So we're working with both housing authorities in many different ways, but I wouldn't say that they have totally joined this healthcare discussion yet, but maybe Kevin has different experience.
Yeah, so I mentioned cultivating health for success and how we've used that. That's moved to primarily a choice voucher option for the housing subsidy on that front. So the county housing authorities, just through the nature of their programs, have agreements in their administrative plans with the county Department of Human Services in Allegheny County for some set asides. And basically when the folks who are in our program work with their housing case manager at Community Human Services, CHS actually has about double the placement rate of the general population in the voucher absorption. So that plays a huge role for us. And, without that piece, it's like we have to wait and see if the person has all the HUD documentation. And, there's people that are, by my definition, homeless, and by my grandma's definition, definitely homeless, that don't get served. And so that's been an interesting place. And I think there's a lot of room to grow there. Housing stock issues tend to be a challenge with Section 8. And there's some other things with the process that could be maybe a little streamlined that could benefit that. But I think that there's a lot of opportunity to think about engaging them more. And I'll just leave it at that.
Biddy, do you want to ask a question?
Yeah, this was a great presentation. Thank you so much. So I'm based on the eastern part of the state in Philadelphia. And my question was more of like, how can we do this? We have Penn here, we have, the University of Pennsylvania health system and hospitals and college. And we have about 38 properties, senior affordable housing properties in the city of Philadelphia. I just feel like we have to do some things like you guys are doing over on this side. And I just don't even know who at Penn to like reach out to or approach, or like, do you know if this is happening here that we can, like a liaison? Do you people talk to each other, like hospital systems talking to each other? I just like all of this stuff sounds amazing, but I just find it kind of like I hit a brick wall when I think about it.
So there is a little bit of competition, but I think it's really a matter of just trying. It's hard to find the right person to get a hold of. And I don't know who that is. I don't know if Penn's coming on. I think Thomas Jefferson is actually signed on to a commitment through what's called the Healthcare Anchor Network, or maybe it's Einstein. I forget which one and who owns Einstein now. It's hard to keep track of all these things. But that would be one way to kind of start that conversation is, you can, the Healthcare Anchor Network, HAN, you could pull them up and see which local people are signed on to their kind of affordable housing pledge. And you could contact the staff at the Healthcare Anchor Network directly to try to mine through some of that. But also, it's not just the hospitals, right? So my work is really with the UPMC insurance side. And we offer some home and community-based supports and Medicaid things too. So AmeriHealth is one of the major Medicaid players there. I know that they've done a pilot with Health Partners, and I think it was, I don't remember the name of the group, RHD. I don't know if Dina's here. She might be able to tell you the actual long form of that. And they've done a really successful pilot that's not unlike our Cultivating Health for Success program. They're just subsidized, they're pulling in grant dollars to pay for the housing component as well. So, AmeriHealth's done different deals, financing all kinds of different things in different markets. So they've been more active in DC. And it ultimately really comes down to a leadership decision. But there's lots of things around, aging in place. One of the things I'm excited about that we're starting to have conversations around is how can we take something that's been a proven, research-proven health coaching model that we've done with community behavioral health centers and move those into residential settings, especially special needs and special population buildings. So that's something we're going to kind of do a slow launch into this year. And there's another place where that can grow. So especially with senior communities and those kind of things. So I know that doesn't really quite answer your question, but I would try Han and ask them if there's anybody that they would suggest reaching out to. And I'll do my best to keep my ears open, and when I meet the right person, let you know who it is.
So that was really helpful. Did you say it was healthcare intranet network? What was the?
So there's two Medicaid providers out that way, and it's Health Partners Plan, I think, HPP, and the other is AmeriHealth Caritas, or they might have changed the name of it now. I forget. I don't know. Healthcare changes its names more time than I can count.
Thank you. That was helpful.
I'll just piggyback one thing, Kevin. I know in conversations that you and I had once upon a time, it sounded like even UPMC has certain things that you're doing that are in fact statewide. Is that true?
So in some cases, with it, we are statewide with Community Health Choices, which is not a health insurance product. It's a managed long-term service and support. So that pays for things like personal attendance services, other home and community-based services for individuals who qualify. And that can do home modifications, things of that nature. So that's a contract we have statewide, and we'll also be a statewide Medicaid provider whenever the contract formally launches, which is our version of, we haven't broken ground yet, which is anticipated for August or September. So we will be active with at least two or three products in the Philly market, and already are in some cases. So that's something we can consider also. Yeah, thanks for saving that one. If there's something that's like really specific, it's something to do. But a lot of the way we've approached affordable housing developments in the past have been around kind of PRIs and trying to think through how we work with intermediaries to develop programs. Lena mentioned the Bridgeways lending for a couple of projects. It's really important for us to have that intermediary, just because we're not trying to become lenders. We're really trying to learn from the expertise or empower the expertise in the field to make more deals happen. And that's our long-term goal here. But yeah, there are some things we do. And so you're always looking that way, honestly.
Thank you. Other questions? There's some active conversation in the chat, but I didn't see any other questions specifically in the chat. Floor is open.
I'm just a little curious with the social determinants of health aspect. Is there, some sort of a study, a baseline that we can look at, and then how this work is improving those outcomes?
Jenny, that is an excellent question. And there's a lot of research out
Yeah.
there, and we can send studies around, but for us, like tracking that, because Kevin and I were thinking about like major challenges related to this work, and there are so many privacy concerns about
Yeah.
health information that while
Sure.
you can assume that if someone has, stable, safe housing and access to supportive services, that their health is going to improve, but like tracking that and having data is really, really tough, and telling that story with actual information from our projects. And we're not there yet.
Yeah.
But we
Yeah,
talk about it a lot. And then also we can't say like, okay, we're building this building and only UPMC Medicaid clients can live there. Like that
Right.
doesn't work. So yeah, we've really tried to figure out how to do this, but there are a lot of different silos in fair housing law and like a lot of ways to
And
navigate
HIPAA.
Yeah, exactly.
it too.
Yeah, and the flip side of that is we can only look at people who are our members who have also signed a consent, right? So like this, you provide if your insurance company sends your name anywhere, that's protected health information. It could just be your first name, right? It's like,
Yeah.
that's really what it means. If it originates from us to anywhere, it's protected. And so that's where we're trying to figure out how do we work with, property managers or developers to figure out ways that we can provide the other, in many of these cases, the income qualifications for something like ERAP, which is up to 80%, like 96% of people are going to be Medicaid eligible. So of that, in a place like Allegheny County, 4 out of 10 people are a UPMC health plan member. That's just kind of how it breaks out kind of at the scale. So what does it mean though to do an intervention where it's like, well, we can cover these 4 people. And so that's kind of the next tier of work for us, is how do we think about it with other partners, and then think about the value proposition of working with a third party evaluator to get the de-identified information from each of us respectively to really make that work.
Right. Yeah, that's what I keep going back to, because we all know inherently, it just makes logical sense. If you're not as concerned about, food insecurity, or knowing if you're going to be able to pay your rent or your mortgage, inherently you are just going to be healthier mentally, physically. Same with transportation, access to healthy food. We know these things. But how do we track them? Like, I sit on the board, I'm the chair for Rebuilding Together Pittsburgh. So Kevin, awesome. Thank you so much. Like, we are so excited about that program, and we're struggling with the same internally. Like, okay, we've got this, we know how to use it, but how do we track the outcome? So.
And that's one of those agreements there. So just to elaborate that a little bit more, our hope is to do home repair for 50 homes, or for Rebuilding Together Pittsburgh to do home repair for 50 homes. We're not really doing anything. And then we're going to try to look at that longitudinally, hoping those folks stay with us. And that's an example of a pilot we've done within the state guidelines through Community Health Choices, which is, again, that long-term service and support to keep people in place. So our hope is that we can do that. And but what's interesting is that we qualify people who sometimes have our Community Health Choices coverage for their home and community-based stuff, but then have a different provider for their medical stuff. So we're going to see what it looks like how many fully aligned people we get to really drive that the total reality of that, but I think we're going to see things. And so, the biggest study the one slide I had referenced one of the bigger studies that was done out of Oregon or someplace like that. And it was, I think, 1,900 households. And it didn't matter if it was families or supportive housing or people with disabilities, like it improves basically across the board. And so it's all about figuring the right fit.
Yeah, there's really good work out of Denver. They've done a lot of interventions with permanent supportive housing for homeless population, and that has a very, very strong research component. And I can send some of those articles to you guys. They may have partnered with Brookings or.
Oh, they have the biggest social impact bonds. It's the most ridiculous. Yeah. There's 27 parties to it. So some of those people are only paying for research. Like, it's a whole thing. It's really neat.
Really cool. Yeah, it's
Okay, cool.
the best example I've read of like actually tracking this data and then using it.
Oh, I'd love to see that. Yeah.
I have a pending with a candidate right now who will essentially become a policy analyst. And so that in that way, we can at least kind of get the sense to say like, okay, funding went into Stanton Highlands. To the best of our knowledge, how many people do we think live there, with some margin of error, and try to think about it that way, and then determine whether or not it's worth hiring a community health worker to go try to get consents and really kind of do a longer term evaluation.
Okay.
Anything else, like those are some of the things we're kind of starting with, and or the preservation work, is it the case that some of these buildings that get funding have like 5 people and others have 50? Okay, if it has 50, then what can we do with the service component to bring in health coaching or social services as part of that planning process is kind of, the thing that I'm hoping to kind of bring to that group longer term. But, if you can't preserve the building, then that's kind of a mute conversation.
Right. Right. Well, this was awesome, guys. Thank you so much.
Oh, thanks for having us.
Yeah, this is excellent.
Are there other questions? I have sort of one more, but I don't want to butt in front of anyone because I already did that. Anyone else?
No, but I like this IT
I guess-
comment in the chat because my sister's friends was in that IT GAD once. I would like drive by and say, Lucian, what is going on here? But anyway, yeah, it's a very iconic billboard.
I always love when we have these sessions and they're very Pittsburgh centric. We get our everybody who lives out west who are like, here's our local color. So I just want to kind of pull on something that was coming out a little bit in your question with BD, and I don't want to overstate it if it's not true, but if it is true, I want to flag that for myself. My sense of so I know, Kevin, you kind of work on the insurance company side. My sense of most of the healthcare and housing stuff that is happening nationally is insurers, not providers. But I also saw Boston Medical Center, which is a hospital, and I don't think has an affiliated insurance company. So I just was trying to kind of understand, is healthcare and housing, is it always the insurance side? Is there other, what else is happening? Yeah.
The answer is no, but the biggest investments do come from things, from entities that have insurance companies. So CVS, United Healthcare, and Kaiser Permanente all together, their total commitment values right now, only some of that money is out. A lot of it's LIHTC purchasing too. So it's is that value add? Not sure. It's a good thing regardless. But those are all coming out of insurance related businesses and those kind of things. When it comes to, so if you look at an institution like Kaiser, who has both UPMC, it's when they're in the Bay, they're really focused on homelessness and supportive housing. But when they're in DC, where they're primarily a payer, they're also pursuing preservation work. And so it's just things change there. In a case like Boston Medical Center is interesting because basically they did a campus expansion, and part of the process for the government oversight in Massachusetts is basically a more defined community benefit thing, which is how the people who champion that work, the doctors up there, Tia James and Megan Sandell, are heroes in every aspect of the word. And just really, we're looking for an opportunity to try to get into this. But part of the motivation for them is they're also part of an accountable health organization, which means they have risk sharing on the healthcare delivery side. So that means it's easier for them to say, okay, this is a neighborhood that's in our proximity. We know that these people are going to come to our hospital, and we know that we're accountable for the outcome, not just the treatment. And so that's a real motivator for them to make kind of community style investments. And that's probably what I would guess is a situation for some of these groups in Philly as well. And so it just changes the scope. So when the hospitals are involved, it tends to be much more neighborhood driven based on where they know folks come with avoidable remissions from, whereas when it's health plans, it's kind of this broader scale, how do we move the needle on social determinants rather than community health. And so that's kind of why I said that, we really do stuff as population health, we can follow, we can do programmings, that kind of stuff. Community health is really those kind of things where it's we're working with this one neighborhood to make it move. And then there's really that public health component, which is that overarching stuff where just things that make sense, like Second Avenue Commons, and it's easy for a bigger corporation to kind of play our share because it's the right thing to do and it benefits the broader community. So I don't know if that answers that directly or not, but.
Thank you. No, that was very helpful. Any other questions? We have a good group here, but very quiet. So please feel free to jump in if you have questions. Okay, all right. Well, maybe we'll give everyone back 5 minutes and thank everyone again for surviving the chaos at the beginning for the second time. My apologies truly, and thank you again, Penny, for kind of jumping in to kick us off. Thank you so much, Kevin and Lena. I thought that stuff was super, super interesting. I got 1 or 2 questions on the side about whether the recording will be available. It will be, we have been recording this and it should be available within a little while. So thank you everybody for joining.
Thanks for having me.
Thank you all.
Yeah, thanks so much for having
Thanks
us.
everyone.
Now
Have a
you
great
guys can
evening,
go to real
everybody.
happy hour.
Yeah. Take care.
Okay, thanks.
Bye.
Bye.
Bye all.